Hi everyone, welcome. I am Dr. Nancy, and today I'm going to be chatting about spinal health in pregnancy and after pregnancy. So, here's my model baby, if they were only all as quiet. So, basically, in pregnancy, there's obviously a lot of changes on the spine. I found the most important thing is to keep moving. There's been some medical research to show that movement is really beneficial, not only for dealing with any potential back or pelvis problems that might come on, like low back pain and things like that, but also helping the labour progress in a good way, especially if you're aiming for a natural delivery. Movement seems to help everything just to stay supple, movable. Your body's doing the best that it can to keep it that way, but I'm sure there are some bumps and hiccups that can come up along the way, which are common and can be dealt with quite easily and readily. So, what I found is so beneficial for my patients is swimming and walking during pregnancy, especially towards the end where the baby's getting a bit heavier. Swimming is fantastic because it does take the pressure off. What happens is when you're pregnant, I'll just grab the spine, there's a lot of pressure on the pelvic floor, which are the muscles that sit here, and also the abdominal muscles are stretching, and also the low back muscles are having to take on that extra load. So what we want to do is really not do anything that's heavy, like running or pouncing or anything like that, that might agitate, even if you're early on, because your body's producing two hormones. One's called elastin, one's called relaxin. So you can guess what they do. Their job is to stretch and allow everything to be growing and moving, and to make room for the baby, and the ligaments get a bit more stretch. So when a ligament becomes more stretchy, it's not as strong. So the strength goes down, but the flexibility goes up. So what you want to do is avoid anything where that's going to cause a strain. I've had many patients that have pubic symphysis strain. So basically that's just this area here, and what happens is sometimes this area can even just not come apart but just be a bit too flexible, can cause a lot of pain here and pain there. So what really we want to do is avoid anything that can cause that. And I think anything where you're doing like squats, one-legged squats, any torsion of the pelvis, please avoid that. I mean, it's not essential. You can do millions of other things, just gentle swimming. I would also avoid any frog leg kicks during swimming, or breaststroke, just to avoid that frog leg kick, because we're just trying to get nice gentle movement, kind of more cyclical movement, just walking up and down the pool, freestyle up and down the pool, just gentle, really slow strokes, just to avoid any excessive movement in the pelvic area, but still allowing there to be some movement, and a little bit of cardiovascular fitness where you're helping your lungs and blood move around your body. Also keep in mind your blood pressure is different. You might be short of breath more easily. As the baby grows, it can push up right under the sternum. So the baby, as it's growing, its legs can be right up underneath the sternum area, underneath the rib cage. So you feel like, your breath might be a little bit shorter. So don't exert yourself. It just needs to be really slow, really easy. If you enjoy just having very slow walks, that's better than nothing. There have been studies to show that the more you stay seated, the longer the average labour can last. So when you have a seated job, try to just get up and move around. And if you don't have a seated job, that's a little bit a bit more benefit to you, as long as you're not fatigued and exerting yourself. So movement is very helpful during the pregnancy. So once you have the baby, doesn't matter which kind of delivery, whether you had cesarean or natural, is that you do need to stay off the heavy exercise like running, and anything like that for about 12 weeks. It sounds like a lot, But believe me, if you've got any weight issues, that don't be concerned about that. It's really not essential. I mean, your body's just done an amazing job of having a baby, a human being. So really, rushing to exercise strenuously is not great, because you still have those two hormones, relaxin and elastin, and some other hormones, prolactin, and a lot of other stuff, which still, like these areas in your pelvis, front, pelvic floor, which holds your bowel and bladder control, and some of the other ligaments at the back of the spine, they're still very stretchy. So please be cautious of that. You need to be around 12 weeks after the baby before you start to aim anything where you're going to do some jogging or running. I would suggest in the first 12 weeks, so the first 6 weeks, no exercise, just easy, I'd say walking, anything, swimming again, very benign, but really after 6 weeks you can start a bit more sort of faster paced walking if you wish, but I would wait until 12 weeks. I mean, personally for me, I waited because naturally I was already a little bit flexible anyway, so if you do have hypermobility, just wait a bit longer. If you're really eager to get back into exercise, just keep reminding yourself, you've got your baby, carry your baby as much as possible. The baby's growing. I find that that's a good weightlifting exercise. Don't carry anything heavier than your baby, especially as soon as you've had the baby. What happens again with those hormones that relax your ligaments and joints is that if you end up carrying something that's too heavy, you are bearing down on that pelvic floor, on these muscles and ligaments down here that support your bowel and bladder. So really, if you don't look after them, they're very important, as you can appreciate that. So when you lift like a very heavy basket of washing or a heavy pot, or something like that, then you are straining them, and it does take a little bit longer to rehabilitate them. So just hold off on the heavy exercise. Simple, easy things. Hold your baby all the time. I think carrying your baby is a great thing. I never actually even knew there was a name for it, but it's called attachment parenting. I didn't realize I was doing it until I was having a look at some information and data, and I was like, oh wow, this thing is great. It actually has a name. So attachment parenting, I happened to coincidentally do it, but basically it involves being close to your baby, holding your baby as much as you wish. I've had people say to me, oh, just put the baby down, otherwise she's going to get too clingy and she's going to want to be held all the time. To be honest, that didn't bother me because I loved her. How she's only little for such a long period of time, even though I did put her down when I was exhausted, when she was asleep and I wanted to have a sleep. The first one, it was impossible for me to put her down because it was just so new, and this feeling was amazing. But with the second one, I knew how tired I would be. You kind of realize the fatigue when it's going to hit. So I knew that when she was sleeping and I wanted to sleep, that was my time to just put her in her bassinet and I could get a quick sleep, good nap. That's a great way to manage your fatigue as well. I think with a new baby, you need to be so patient, because these things aren't designed to sleep. I was actually reading that it's one of the baby's survival instincts to not really sleep a lot because they need to wake up frequently for feeding. It is a sign of a robust, healthy baby when they're waking up hungry anyway, and they're not used to, in your womb, when you're moving around during the day, the baby's getting rocked, the baby falls asleep. When you sleep during the pregnancy, baby wakes up, kicks a little bit, as you probably realize towards the end of the end of the third trimester, baby kicks a little bit more frequently at night. That's because they're awake at night when you're trying to sleep, and vice versa. So be patient with the new baby. They are not designed to sleep, and I've had two almost, I could say, terrible sleepers. The second one wasn't as intense as the first. However, they're just not designed to sleep. Just be patient. If some other person's kid is sleeping and yours is not, don't worry about it. They're very rare where you get a sleeping newborn, and they all kind of